wash my hands before I enter the room, have my supplies gathered, check my doctor's order. And I'm going to provide privacy as I've shown. I'm going to introduce myself to the patient. Hi, my name is Marcia. I'm going to be inserting an IV. I'm a CW University nursing student. It should only take 10 to 15 minutes. Do you have any questions at all? And they don't, so I'm going to go ahead and start. I'm going to make sure that I have, I would make sure that they're safe, their bed breaks are on. I would raise their bed to a position that is workable and make sure I have all my supplies set up here. Alright, I'm going to grab some gloves. Okay. Alright, so first I am just going to prime my extension tubing, alcohol swab. I'm just going to make sure there's no air, there's fluid in there. So that's set. I'm just going to leave it here. Then I'm going to attach, put on the tourniquet. Nice and tight. You don't want to leave the tourniquet on more than 2 minutes. So I'm just going to go ahead and chlorhexidine the site here, hand. Okay. I'm going to prepare my tape and make sure that I have enough. Alright. So I'm going to go ahead and find a site. This vein right here looks good, so I'm going to go ahead and go in there. Apply my gloves. Okay. So I'm going to insert the IV bevel up. Do it at a narrow angle here. Insert it. I'm going to be looking for feedback. Alright, you'd want to make sure you had feedback coming out, but just for the video purpose, I'm going to go ahead and just insert it and pull this out and hook up, oh, there's blood return. Hook up the extension tubing. And I am going to flush it just to ensure that placement is correct. And I'm just looking for no swelling, making sure that the blood's going in. I'm going to release the tourniquet as well. Alright, so it is placed, so I am going to tape it securely. And make sure it stays in place. It's kind of tricky. I want to make sure it would stay stable. Probably want a longer piece of tape there. And then you can go ahead and put the tegaderm over it. And on the tegaderm you want an initial date and time when the IV was inserted. Alright. So now I'm going to hook up, and I would chart the IV site, the location, how many attempts it took me, and just as well as the gauge of the IV, how they tolerated it, and that information. So I'm going to go ahead and hook up my IV tubing. I would check this with the MAR and make sure it's the right route, solution, time, patient, right dose. I'm going to go ahead and prime my tubing here, make sure it's on clamped. Just going to prime it. Basically, you want to make sure that there's no air in the tubing. You can just clamp it back off. And then I'm going to go ahead and hook it up here. I would alcohol swab this for 15 seconds. Make sure it remains clean, sterile. And then I'm going to go ahead and hook it up. Alright. So my IV is all hooked up and running. And I would go ahead and document as well. And so what else I'm going to do is discontinue the IV. So the doctor has ordered to discontinue the IV. So I am going to make sure that I clamp it. Go ahead and unhook it. Just bring it back up. I would discard my supplies. Get my gauze strips ready. I would have removed my gloves, washed my hands, and reapply them because it would be a different time with the patient. I would also, before, I would have wanted to make sure I verified the patient's name and date of birth, the two identifiers. So I'm just going to take the tegaderm off, remove the tape. In real life, this would be much more secure. And I'm going to go ahead and apply pressure above, and then I'm going to go ahead and remove slowly and apply pressure and hold it on there. I'm looking to make sure that the catheter is intact and that there's no deformities of it. I would go ahead and discard it in the sharps and which is over at the wall, so up here. And then I can go ahead and put a piece of tape on just to keep the Band-Aid on there. And I would also document that the catheter is intact, and also just the maintenance of IV. You want to make sure that there's no swelling or redness, that no irritation, no infiltration, or issues with the IV site as well when you're doing IV. And before I left, I would ask my patient if he had any other questions, if there's anything else I can do for him, and if not, that would be it.
Just hit the record button again.